Full the video. Okay. So today we are going to discuss about the topic called gut imbalance and surgical complications that gut imbalance leads to. So many people don't take care of this gut imbalance. Main problem with gut imbalance is many people have digestion issues, bloating, acidity. There are different reasons for this. That may be because of small intestinal bacterial overgrowth, hyperacidity, hypoacidity, or due to the permeability, membrane permeability disturbance. So these are the different reasons and the bacteria which is present in the intestine, like good bacteria or bad bacteria. There may be discrepancy between the growth of good bacteria and bad bacteria. So all this leads to indigestion issues and mainly constipation. So how this indigestion or imbalance of gut leads to surgical complications or surgical problems. So the main problem with this gut imbalance is indigestion or constipation. So how does constipation? We know that because of constipation, people will put some pressure while passing stool, which leads to hemorrhoids. So these hemorrhoids, they may start initially with some grade 1 or grade 2, then slowly they progress. This is one most important complication. And the second thing is due to constipation, the stool which is present in the intestine, it will accumulate for longer time. So prolonged period of time of accumulation of this stool leads to inflammation and release of toxins into the blood due to this accumulation. And the membrane which is present, the intestinal membrane, may also get inflamed due to prolonged period of time. So all this leads to, or sometimes there will be change in the genetic predisposition of the cells, which leads to carcinoma, colonic carcinoma. So the main important thing here is because of this gut imbalance, because of discrepancy between the growth of good bacteria and bad bacteria, that may lead to indigestion, which leads to constipation, which again leads to uh, surgical problems like hemorrhoids and mainly colonic carcinoma. So we in our clinical practice, we are seeing a lot of cases related to this gut imbalance and associated surgical problems, mainly perianal abscess. Again, perianal abscess, there'll be accumulation of stool, there'll be constipation, that hard stool which will press that soft membrane, anal canal membrane, and there will be breach in the anal canal. There will be high chances of entry of bacteria into that breach, which again leads to perianal abscess. So hemorrhoids, fissure, perianal abscess, colonic carcinomas, and due to this perianal abscess, if this perianal abscess, if it is doesn't treated, if they don't treat that, sometimes people they themselves go to medical shops and get some antibiotics for this perianal abscess, or they will use their finger or nails to breach that abscess out. They themselves try for that, but what happens is this may lead to fistula formation, because whenever the pus doesn't drain out completely, there will be chances of fistula formation. So this is one important thing, fistula in ano due to complication of perianal abscess, because people are afraid of surgery. They don't go for surgery. Then because of this, there may be chances of fistula in ano formation. Now again, we have discussed like hemorrhoids, fissure, fistulae nano, perianal abscess, and colonic carcinomas. These are the most common surgical problems due to gut imbalance. Now, even umbilical hernia can also happen due to gut imbalance. Why? Because of indigestion or gut imbalance due to decreased frequency of stool. There'll be again constipation and there'll be pressure in the umbilical region. Or if there is, sometimes people may have IBS. IBS has two types, constipation and diarrhea. People has diarrhea, there'll be fissure formation. If there is constipation, then there will be like hernia formation and hemorrhoids, all these things. So why gut imbalance happen? So there are different types of reasons due to intake of processed foods, junk foods, or sugary drinks, or anything that disturbs the permeability of the membrane, which leads to leaky gut. So all these processed foods, junk foods, and sugary drinks, they what happens with the sugary drink? Someone have sugary drink. This is a easily digestible, readily available carbohydrates. Then there'll be no work for the acid to do. That carbohydrates, that readily available drink will directly go to the intestine, and that leads to like the bacteria will feed on that sugar, the bad bacteria, and there'll be growth of bad bacteria. This is how sugary drinks pathology, pathophysiology happens in the intestine. The readily available carbohydrates, that means there'll be high chance of growth for bad bacteria. If someone has fiber, then it takes longer time for digestion. Then the good bacteria acts on that fiber. It digests, acts on that fiber. That bacteria helps in digestion of that fiber, which leads to formation of good metabolites like short chain fatty acids, butyrate. All these are short chain fatty acid metabolites, which helps in prevention of toxins formation in the gut and intestine. So if that doesn't happen, what happens? There'll be accumulation of fiber, then there'll be fermentation of fiber. This fermentation and accumulation leads to gastric indigestion and bloating mainly. So the main important thing here is diversified bacteria. So that will not focus, because many people will have same food over a week. That will not help because you are not diversifying your gut. So we need to diversify that by taking in like different types of green leaf vegetables, fruits for antioxidants, because whatever food you are taking, all those junk food will create free radicals in the intestine, and these free radicals will spread through the membrane into the blood and create toxicity formation. Reason why people will have acne, reason why people are having fatty liver. All these toxins are creating endocrinological issues in the body. So these toxins are eliminated by antioxidants. So fruits will help in that. And green leafy vegetables acts as fibers, which helps in release of metabolites, good metabolites, which leads to formation of serotonin and dopamine. So the neurochemical hormone is much more important. So reason why, in if you have some processed foods regularly, junk food regularly, all this reverses. Probiotics, prebiotics number come down, antioxidant number come down, carbohydrates number goes up, which leads to growth of harmful bacteria in the gut. This harmful bacteria itself creates a lot of mess in the intestine or gut, leading to indigestion, bloating, brain fog, acidity, acne formation, hair fall, IBS. So all these are correlated and interrelated. Now, that is why when the digestion is not good, however, we will try for the flow of intestine, like we'll try for the evacuation of the bowel, which leads to constipation, which leads to fissures and hemorrhoids formation, and IBS leads to again fissure and hernia formation. So the main important complications that may happen due to gut imbalance, the surgical complications are like one is hemorrhoids, fissure, fistula in ano, secondary to perianal abscess. Then, not rarely I can say, but most commonly we are seeing in the clinical practice even colonic carcinomas and rectal carcinomas as well. So what we have to do, the most important thing is balancing gut through proper diet like green leafy vegetables, hydration, properly doing your gut hydration, and colon hydrotherapy sessions may help sometimes if there is growth of overgrowth of bacteria that is harmful. Then fiber diet, high protein diet, high antioxidant rich diet, probiotics, prebiotics. All this helps in formation of postbiotics, which will lead to proper digestion of your gut digestion. That helps in prevention of surgical complications. So this is a no one will focus on this point like gut digestion problems leading to surgical complications. So I want to touch that area. Like, yes, even if you have gut imbalance, that doesn't need only bloating. That doesn't indicate you have only bloating or acidity. That indicates that if this continues, there are high chances you may undergo a surgery for piles, for fissures, for fistula, for perianal abscess. We don't know. So even obesity may happen because of indigestion, because how much ever you are eating. It is not your body is not accumulating that nutrients. So you're going on eating and your cells are blowing up, leading to obesity. There is no bone mass, there is only muscle, there is only fat formation. All this leading to obesity, and again, obesity is a great surgical. Obesity leads to again umbilical hernias, inguinal hernias, and complications like hemorrhoids and all. So everything is interrelated and correlated. Don't think that if you have acidity, it is only acidity. It is acidity now, but it may turn out to be like any surgical complication or even cancer in future. So don't neglect your acidity, bloating problems or gut imbalance issues. Get them treated as early as possible or change your lifestyle as early as possible. And if you have any surgical issues related to piles, hemorrhoids, and fistula, pilonidal sinus, perianal abscess, hernias, I am Dr. Ravuteja, laser and laparoscopic surgeon and robotic surgeon in Honest Robotic Hospital. I'm always available here 24 hours for your service. And even I can reset your gut with proper advices. So thank you so much for paying attention. If you have any such issues, you can reach me out